Today we are doing Botox, and Botox is a muscle paralyzing medication. So we love it. It's the most common aesthetic procedure done in the world. And what it does is it helps prevent you from furrowing, it helps prevent you from raising your eyebrows, it helps prevent those crow's feet, and it can even do things like help with the bands in your neck. It can help relax the muscles of your masseters if you grind or you get TMJ or headaches. So there's a lot of other medical reasons for it too, but today we're going to do it to help with our patient's grimace and to help lift up her, they're called DAOs, to help give her a little bit of a jaw lift, I guess. We're going to soften her chin and we're going to do crow's feet. So first we're going to start with the glabella, and that's the area otherwise known as the 11s. And I'm just going to balance right here, and I'm going to start over your right eyebrow. 1, 2, 3, here we go. Awesome, perfect. We're going to go again, here we go. Good job. And we're going to go left eyebrow, 1, 2, 3. Good work. And we're going to go right left eyebrow again. Great. We're going to go middle, boom. Okay, and we're going to just wait for a second. So that's the glabellar area. And now we're going to do what's called the DAOs, which are the muscles on the sides of the lower face here, right down here and here. So turn a little away from me, perfect. Okay, 1, 2, 3, here we go. Boom, here we go again. Let's go over here. Oh, perfect. It's like you know exactly what to do. Here we go again, and one more here. Excellent. Okay, so that's it for those. And next we'll do crow's feet. There's a little bleeding. And so you can get little bumps that occur. They last about 5, maybe 10 minutes. You know, by the time you get anywhere you need to go, they're going to be gone. So we often will do Botox on lunch breaks, which is great. Okay, so now we're going to do crow's feet, and I'm going to have you turn away from me. And I'm going to start right up here, 1, 2, 3. And the amount of Botox recommended for crow's feet is 12 units per side. If you do less, it's probably not going to last you as long, and it's not going to have as much of an effect. So oftentimes will have people that just want to do a little baby bit, and I tell them, don't bother, just come back when you're ready to do the full treatment, because I don't want you to do half dose and then say it didn't work, because it probably did work and you probably just didn't do enough. Okay, I'm going to go over here, 1, 2, 3. There we go, awesome. Lower. There we go again. So it could take anywhere from 3 or 4 days to 2 whole weeks to work. So you just have to be patient. And now we're going to do your chin. So I'm going to start down here. 1, 2, 3. You're doing great. So chin can take anywhere from 10, 20, even 30 units, depending on how strong of a muscle you have there. And it's for people that have what's called pude orange. It's like when you do this and you don't like this, we can soften that. So those are a lot of typical areas that we do Botox. We did not do her forehead, but you could do forehead. That's generally 10 to 20 units up here. Well, actually 20 units, FDA recommended 20 units. This area is 20 units to start. Those are the doses that are going to get you 3 to 4 months of paralysis. Masseter muscles, we could treat, like I said before, that generally starts about 30 units. I've done up to 80 units per side, but that can give you a year of paralysis, which is great. I do my masseters because I grind, and now I don't grind anymore, which is perfect. You can also treat hyperhidrosis, which means excessive sweat under the armpits or in the hands or the feet with Botox. That can last you for a whole year as well. Each armpit's typically 50 units. So the very important part of doing Botox is to know your injector, and at RejuvenationMD, we're in the top 1%. I think we're actually number 13 now in the country with the amount of Botox and fillers that we do. So, and we're not a chain, so that's exciting. And we have got 7 very experienced injectors that that do Botox, I mean, all day long, every day. 2 people as well as ourselves. So it's always good to be on both ends of the needle. But like I said, it can take 3 to 4 days for Botox to kick in, up to 2 whole weeks. So if my patient was a first-time patient, I'd have her come back in 2 weeks and make sure everything looks perfect, and then it should last for 3 to 4 months, which is excellent. It's very, very safe. You know, besides possibly bruising, which our patient isn't going to have, there's really little risk of side effects. So I love Botox. I think you'll love Botox if you don't already do. And if you want to find out more about it or see if you're a good candidate, you can find us online at RejuvenationMD, medspa.com.